My dear friends, I'm very happy to be with you. It's today, I don't know where you are in the world, but today where I am, it's a glorious, beautiful day. And it's one of those days that you say, this day is worth living. I'm Dr. Rodrigo Rodriguez, and I'm here to talk with you exactly about life and enjoyment. And you cannot achieve it if you're not healthy, if you're not in good shape, if you don't feel good. So BioCare Hospital is what it has been talking about for decades now, since the 1970s. We have been working day in, day out to make people healthier, to function better, and also to recover. Because we hear so many times, we hear it all the time, that, well, if you jog, if you go to the gym, if you do this, if you do that, you're going to be in good health and so forth. And it gives me the feeling that once you have a disease, once you have a serious health problem, it seems like everything is over for us. I mean, I have cancer, and I have a very serious illness. There's nothing else for me. I cannot go to the gym, I cannot do this, I cannot do the other, so what's left for me to do? It's too late. I'm too far gone. Those are very frequent statements. And I'm here to tell you that it is never late and you are never far gone. There's so many options. There are many things you can do for your body, because we have a fantastic body. We have not one of the best, we have the best machine ever created. It was created in perfection, and it was given to us to enjoy. But when anything goes wrong, I want you to know that there are so many resources within ourselves that all we have to do is set them in motion to start feeling better, to start functioning better, to start healing, in one word. And that can be achieved. You know, they say that one day a very famous optician who used to make lenses for glasses, lenses for microscopes, lenses for everything, said, if I had a guy that made a lens with all the little defects that the human eye has, I would fire him instantly. And somebody told him, if I had a man that could build a lens like the human eye, that in spite of whatever little things it might have, it can always adapt, it can always change, it can always go forward and retract and move and adjust to light and do everything by itself, I would give him the Nobel Prize. And that's what our body is. Yes, we might have some little defects, we might have some little problems, but if we know how to turn the key and how to get all the resources we have within us in motion to heal, to feel better, we're going to have a total different life in spite of any health problem that we might have. Not only in spite of, but we can say also that all these resources, when they're set in motion, they can help your body to come back, to heal, to recover. We have learned, because they have told us, to forget about a word that was very important just 50 years ago, but they have taught us to forget about the word cure. You don't cure anything. And that's what they tell you. And they tell you, you go to the doctor, you say, I have this problem, what am I going to do? And the doctor tells you, well, you have to take this medication. The obvious next question is, for how long? How long am I going to be on it? And the doctor says, for the rest of your life. which means you're never going to get over that disease. So, first lesson, very important, don't get sick. Try to avoid it, and there are many ways, and we have discussed many times how to avoid these things, okay? How to go around them. You don't have to get sick. But you have a problem right now, so that's not your choice. Well, you can do things that are going to shorten your suffering, that are going to diminish your suffering, that's going to make your life a lot more bearable. And in the process of all these things, one day you might conquer the problem that's affecting you. And I'm not saying this as a philosophical situation. I'm saying this because being a doctor for over 50 years and working on alternative medicine for most of that time, and working with people and learning about their metabolic circumstances, about their defense systems, about how wonderfully the human body was built, I can tell you that I have seen cases where the only word I could use is a miracle. But miracles do happen. So all we have to do is we have to look for them. So if you have a serious disease, if you're at home listening to this broadcast, and you're suffering of pain, of inflammation, inflammation always brings pain. If you don't have any appetite, if you feel bad, if you're in any sort of a distress, well, I want you to keep on listening. I want you to keep with me. I want you to ask a question. I want you to contact me. I'll be very happy to give you a free piece of advice. I'll be happy to explore what your problem is and help you to go through it. If nothing else, you have a good friend to talk to. So I want you to follow me. I'm on the social media of your choice. Twitter, or Instagram, Facebook. I have broadcasts on YouTube, and all you have to do is search for Truth Be Told Radio Network on Spotify, and you're going to have over 100 hours of conversations like this. But I'll be happy to talk to you one-to-one. So all you have to do is go to any of these sites, follow me, ask a question, start a conversation, because I know I can help you. So by doing all this, we're going to achieve what I love to be about being a doctor. You know, I hate to be a doctor when you have to tell a patient there's nothing else you can do. I hate being a doctor when you see that something didn't really work because I didn't try hard enough, or because somebody just didn't want to do anything. But when we follow advice, when we discuss it, and doesn't necessarily mean that I'm right, but there's a lot of common sense in all this, and there's lots of information pieces on the web and around us, lots and lots and lots, and thank goodness increasing every day more. And thank goodness better validated each and every time by important scientific work. So it means that yes, we have been right from the beginning. One of the things that has been very, very satisfactory for me as an alternative doctor is that I had never had to take my words back and say, sorry, I was wrong when I told you to do this. I'm sorry, I did a mistake. I shouldn't have advised you to take vitamin C. I shouldn't have advised you to do this sort of exercise or this sort of food program, as it has happened with medicine. Because all of a sudden we discovered that was touted as the healthiest thing. Not only is not healthy, but it's harmful. which is vegetable oils, vegetable lard, margarine, mayonnaise, and all these substances that contain these grain oils. They're not vegetable oils, they're grain oils. They're extracted with chemical solvents, those oils from the grains, like corn and soy and you name it. So when you start thinking a different way, when you start going back to what has always been right, which are the natural fats, for example, now that we're talking about fats, and you go to lard, or you go to olive oil, and you go to real butter, you're going to get your health back. Now, if you know how to do it, if you know how to implement it, if you know how to supplement, because there's so many nutrients that have been lost in translation, so to speak, because we started eating what we loved, not what we should. Many people don't even know where to start. Many people don't even know how to eat better. But when you see a patient, and I'm going to talk about it in more length in the coming segments, but when you see a patient and you analyze their lifestyles and you start making changes, well, in the beginning they might sound like, do I really have to do this, or I really have to do the other? And all of a sudden they start discovering the benefits, the feeling, all the advantages you're going to get by making very simple lifestyle changes. Then you're going to begin to think, I'm going in the right direction, because I feel better, because I feel a little bit more, I feel stronger, I feel like I can do more things, I feel better in my mind. Many people lose their focus, their mental focus, their emotional health. And all those things start coming back to you, little by little. Then it becomes a winner, because you know that tomorrow will be better than today, and the following day will be even better. So don't go anywhere, because if you have any serious disease and you're listening, you're going to have a lot of very good advices. We're talking today about a different situation. I'm Dr. Rodrigo Rodriguez, and I'm always telling you about what to do to be healthier, what to do to bypass serious chronic illnesses, how to remain healthy and functional and be in good shape. And those of you that have followed me, you can follow me on Twitter or Instagram or Facebook. I have a broadcast channel at YouTube, or you can go to Spotify and search for Truth Be Told Radio Network and listen to broadcasts like this. We broadcast this every Friday night at 7 p.m. Eastern Standard Time on Truth Be Told Radio Network. And we have a repeat every Saturday morning at 9:30 Eastern Standard Time. So you can listen to a lot of these programs. You can listen to segment by segment. You can get together with people you love. You can ask somebody else to listen to, because it might be a message that they might be wanting to hear. Because when we have a health problem, we're always looking for answers. And today I'm talking not to those that are in good shape and healthy and just want to continue to be healthy and have a long life and functional and enjoyment, etc. Today I'm talking to those that are probably sitting in their home, in a couch, in a recliner, or in bed, because they hardly can do something else. Or even if you're mobile and going around doing things, you know you have a disease that has been touted as deadly disease. And there's probably not one diagnosis that's more frightening than when we say cancer. And you say, well, there's nothing else I can do because I have cancer. So I have to get my therapy, I have to get my chemotherapy, I have to get radiation, they're going to operate on me, and doctors have told me that this might happen or the other, etc. And the outlook is very gloomy, it's very sad, it doesn't look good at all. Because your doctors have not told you that within your body you have a whole arsenal of weapons to fight back, to fight that cancer, to go head on against it. See, we have to remember that cancer, and this is something that really I have been looking at, and I don't see anybody being concerned, being worried. We're seeing more cancer, and more cancer, and more cancer. As terrible as the disease is, nobody seems to be aware that we're looking at more cases every time. And then you say, you talk to your doctors and say, doctor, but I'm looking at cancer as being more and more frequent. And you know what's the answer? The answer is, of course, you're looking at more cancer because we're living longer. If we have more people reaching 80s, yes, we're going to have more cancer. Makes sense? To me, doesn't. Because I see people with cancer in their 70s and 60s and 50s and 40s and 30s. If we're living longer, that's why we have more and more cancer. How come I see a lady with breast cancer when she's 35? I would probably accept the fact that she's going to have breast cancer when she turns 80 or 85, but not when she's 30, 35. Not only that, but if you look at statistics, you're going to see that cancer is the second cause of death among adolescents in the United States just after car accidents. That's the second cause for which an adolescent might die, because a lymphoma, a sarcoma, forms different forms of cancer. So no, don't let anybody fool you. We have more cancer because we're bringing it to us. We're not talking of an epidemic. We're not talking about a bacteria or a virus that comes here and produces cancer. No, we're talking about a degenerative process of the body that allows, and in many cases even encourages, cancer to grow. Cancer, in very few words, is a number of cells that begin acting differently. They begin to forget the rules that governed the body. Ever since we're born, there are a lot of rules that govern the body development and the future of everything that happens in our body. So, and you can see it every day. It's a real miracle. We might not think about it, but it is a real miracle. You have a baby being born today, and you see them 2-3 weeks before, after, and you see that this baby has grown. And it continues to grow. And then it has longer hair, and then starts developing a number of different things and capacities, and now it can recognize the mother or their father, and then starts making noises, and then one day starts crying because it's already developing teeth, and we keep on going and going and going, and then starts growing and then stops, then grows more and stops, then it grows more. There's a number of divine rules that govern how the body develops. And then at some point, it stopped growing. We don't grow forever. Nothing remains forever within our body. Everything has a rule. And if you take 1 million people and you take their livers and put them on a scale, you're going to see that very much every liver has the same weight. What is the meaning of that? The meaning of that is that our body was created with a set of rules that balances every part of the body and every function of the body. And when any part of those cells start doing what they shouldn't be doing, well, we have a surveillance system that can detect those cells and say, you are misbehaving, so you're out of here. Those cells are going to be tagged and destroyed by the immune system, which is our police department. It's our surveillance, our safety valve to eliminate any cell that's not going to be doing what it should be doing. But every now and then, those cells start to progress and then start creating groups of cells that function the wrong way and create a mass of cells that we call a tumor. And when those cells are misbehaving badly, we say they are cancerous cells. And they grew because our immune surveillance system failed. How come it failed? Probably because something we did wrong. I agree. As we get older, our immunity goes down in general. So it's not surprising that if you reach 80, 85 years old, you might develop a tumor. But not when you're 50. That's unacceptable. That means we're doing something wrong. And even at 80, 85, we have societies like the Japanese or the Spaniards that go well into their 90s with fairly low rates of cancer. The rates of cancers that we see in the United States are equal to none. And that's probably because of our lifestyles. And we have discussed that many times. But the important thing now, today, is that I'm talking to those that are suffering, not to those that might have a problem. I'm talking to those that already have a tumor, that already have a treatment, that are already suffering the ravages or the consequences of the cancer or the treatment, because unfortunately the treatments for cancer are also very aggressive, and in many cases so aggressive that people have to quit. I cannot take this anymore. I can't. I just simply can't. Or they had a massive surgery to try to stop on the tracks the growth of the cancer. I'm talking to you that probably feel completely hopeless, that probably feel this is it. And I'm telling you because I have talked to many patients. I have been face to face with people that tell me, doctor, don't worry, this is it. I distinctly remember a beautiful lady that told me, doctor, don't worry. You don't have to worry. She had the cancer. I was the doctor. Yet she was telling me not to worry. Because she told me I have had a beautiful life and I remember this part distinctly, and I owe nothing to no one. So I can go anytime. Well, that's very good because it diminishes stress. That it's very different than when you're a young parent and have cancer and you think what's going to happen to my family. It's very, very different. But still, you start thinking, there must be things I can do. And this idea, there must be things I can do, began in my life as a doctor probably 45 years ago. I met a beautiful doctor that was doing these sort of things. She started me into this, and I grew to love these procedures because they work. So stay with me. We'll continue talking. My dear friends, today is kind of a special day because we're talking about those of you that already have a health challenge, a health problem. And it might be of any nature. It might be a cancer, and something that's actually I want to have one of these long conversations with you about the effects of the COVID infection. Because I have talked to many people every day, and many people that have come to BioCare Hospital that have encountered benefit and well-being after having a lot of symptoms of dizziness and depression and lack of sleep and all these terrible things that this terrible epidemic has brought upon us. But today we're talking about cancer, when we're talking about people that feel probably not desperate, that's not the word, I would say hopeless. They have kind of an idea that they have reached a point of no return. And I can tell you that I have so many patients. And you can go to YouTube, to our channel in YouTube, and look for testimonials of people that came to BioCare telling me exactly that. My situation is hopeless. I'm too far gone. I'm here because of my spouse, because of my children, because of whatever. Somehow, something told me I should come to BioCare Hospital. But I know this is too late. And then all of a sudden, one day, I get across them in the hospital and say, good morning, and say, good morning, like chanting. And they start feeling better, and they start feeling better. And then I see them long time after. I have patients with terrible diseases that I talk today that I saw 30 years ago. And I have many more that have died because they grew old, not because of the disease. I have a patient that I loved, and she had colon cancer. And when she came down to BioCare, she had already had surgery. But no, that was not what was very different in her case. The big difference is that her husband had colon cancer diagnosed just a week apart. They both came down. And then I told him what I thought we should do. And I told him how we should implement this program. And she said, okay, I'll do it. And you know what happened? Her husband said, no, that's not for me. Don't tell me that vitamin C and this and food, etc. are going to cure me. No, I'm going to continue, I'm going back. They told me I can take chemotherapy, that I can do this, I can do the other, etc. And he went back. She stayed with us. She did the whole program. Not only she did the whole program, but she came for follow-up treatments every now and then. Every time she felt something was not working well, she would come down. That would be once a year, year and a half. And of course her stays were a lot shorter than in the beginning. But she continued. She followed through. And then she started coming back because she told me, no, I have to come back because I'm getting old. Now I have these aches and pains, or I have the other thing. I just want to stay younger and feeling good and functional, etc. And one day she tells me, you know what? I never thought I would be coming to BioCare because of rejuvenation, because of these programs. I thought many times my life was over. And now my problem is I'm over 80 years old. And finally she died close to 90 years old. Nothing related with cancer. Her husband, he died 6 months after the first visit. And something that makes me very happy is her children come to BioCare for rejuvenation, for health restoration, to have checkups, and just be as healthy as their mother was, with a cancer diagnosis in between. So don't give up. What you have to do is you have to be ready to make lifestyle changes. Remember that the best weapons, the best resources that you have against cancer are within your body, but you have to set them in motion. I'm going to give you an example that's also very important. And this has been research at University of San Diego, University of California in San Diego. They notice, and you probably have heard, of people that get chemotherapy, and some of them get very good results, but some of them don't get results. It's like when you give an antibiotic and the bacteria is resistant to the antibiotic, it happens to chemotherapy. In some people, you give the chemotherapy and it doesn't work. Or you give the chemotherapy and it works beautifully, 1 time, 2 times, 3 times, and all of a sudden stops working. And you know what? Those people, one of the problems that they have developed is inflammation. And inflammation produces a number of substances in the body, okay, that we call prostaglandins in general, but there are chemicals in the body that circulate in your body and produce a lot of the inflammation symptoms, the aches and pains and the feeling that something is not in their place, etc., that makes our hands stiff, and all these things. And those markers, when they're very high, they block the efficacy of chemotherapy. So if you go through a BioCare program and you fight inflammation, because all our programs go against inflammation, because I know that 7 out of 10 people are going to have chronic inflammatory processes that I can reduce, that I can handle. How? The way nature handles it. There are many substances in and around us that can fight off inflammation. And if I decrease those inflammatory levels, all of a sudden, many medications that I can use against cancer are going to become effective again. Or they're going to be more efficient, which is going to give me better results with less medication. Just by doing things that are going to help your body to function better. And one thing that you will notice as you lower inflammation is that I'm sure you have heard of the fact that many people with cancer therapy will develop nausea. Well, if you keep your bowels clean, if you keep your bowels detoxified, if you keep a good intestinal flora, which is what we do every single day with all our patients. We begin the day with cleansing, detoxification, intestinal flora replanting and regrowth and all these things. The nausea is going to go away. Because it's not surprising at all that nausea begins in your tummy. That's why when you eat the wrong thing, one of the first reactions you see from your body is nausea. Nausea is actually a mechanism of defense. When the body feels something is offending it, it tries to throw it out. So you either get nausea or you get diarrhea. One way or another, the objective is the same. Whatever is the offender has to go out of my body. Either I throw it up or I put it in the toilet. So that's what we do with our patients, so they don't have to get to that point of toxicity where they need to vomit or they need to suffer with nausea. So when patients come to BioCare, they're going to feel in just few days a lot of relief. And many patients, when they go home, they say, "Doctor, how can I keep on doing this? How can I keep on doing that? Doctor, how I'm going to keep my detoxification process," and so on. And we have an open 800 line for all our patients to call every day if they want to, step by step. Because once we hold them by the hand, we will not let that hand go. We want to be with them because I know they need support. They need advice. And also, I think they need inspiration. They have to be motivated. And we cheer them up. We show them the results. We show them what they have accomplished with the blood work, with chemical numbers. There's nothing about a gimmick where you say, "Oh, I feel better." No, you're better. You see your liver markers, they're much better. You see your inflammatory markers, they're much better. You see your immune markers, they're better. And you can feel it. And I have seen people that came in a very advanced situation, people that came in a stretcher, in an ambulance, people that came on a wheelchair, family desperate, family very saddened because they think that's the end. And when they start seeing the recovery, they love it. They love it. We go with intravenous feeding, we go with intravenous supplementation. We target the supplements that we're going to give because many cancer patients will arrive dehydrated and starving, because that's part of the disease, part of the treatment. Lack of appetite, nausea, vomiting, diarrhea. Nobody can sustain a body under those circumstances. You need help, we can give you help. My dear friends, I hope you have been with me because this is a very important conversation. I'm Dr. Rodrigo Rodriguez and I'm coming to you through the courtesy of Truth Be Told Radio Network. We broadcast every Friday night at 6 p.m. Eastern Standard Time, and we repeat that program every Saturday at 9:30 a.m. Eastern Standard Time. But you can go to Spotify and search for Truth Be Told Radio Network and get over 100 hours of these conversations with Dr. Rodrigo Rodriguez. Or you can go to the social media of your choice. And please join. Please follow me. Please listen to segments. You don't have to listen to the whole program. Share them. Because it's important that people know all the resources, all the possibilities they have to change their lives for the better. Because there's nothing more important than health. And this epidemic has shown us a lot of lessons in that respect. We used to take health for granted, even though we didn't have it. Actually, the general health of the American population has been going lower and lower as years passed. In spite of the whole fantastic medical environment and resources that we have, the general health of the American public is not getting better. We have more and more people with diabetes, more and more people with high blood pressure, more and more people with heart disease, with vascular disease, with strokes. It's every day we wake up or we go to work to learn someone is getting a stent. And we say, oh, wonderful. What a technological achievement that you can go and place a stent in the heart. But we never stop to think that that didn't have to happen. When you get a stent, it means something has seriously failed in the way you have lived your life, in the way you have taken care of yourself. Same when you listen somebody had cancer. The first thing we have to do is what failed. Many times I make this comment. People come to me and tell me, Doctor, why did I get cancer? And I don't tell this to the patient, but I think it to myself. I'm not surprised when somebody gets cancer. I am amazed on how many of us can live for so many years free of cancer. Have you ever stopped to think that? And you say, all these people at work, at church, shopping mall, etc., that do not have cancer. We have a lot more people without cancer than people with cancer. Why does that happen? Because we have a body that was created in perfection. Because we have a body that has so many resources. We all produce cancer cells every day. But we locate them, we tag them, we mark them, we destroy them. Because we have an incredible immune surveillance system that can detect those abnormal cells and destroy them. The same way that as a very efficient police department would get rid of all the criminals from the streets. But if the police department is not doing its job, all of a sudden we're going to have burglars getting in your house, drunkards running the streets, thieves pulling your wallet. That's what cancer is. Cancer is a group of self cells, our own cells, that are in complete misbehavior. They're doing what they shouldn't be doing. They're attacking the other cells. Same as a thief. A thief is not going to go and bite a dog. He's going to steal from a fellow person, from a fellow man, from a fellow woman. That's what these cancer cells are cells that start misbehaving, and they're going to be attacking other cells, healthy cells. So you have an immune system that's going to go after those cells and destroy them. But what if my immune system is not working properly? Because I smoke, because I drink a lot of alcohol, because I take recreational drugs, because I overeat, because I'm obese. Because in one word, my lifestyle has destroyed my own resources, and my body doesn't work well anymore. Now I have a very corrupt, rotten police department, so anything can happen. They're going to break in my house, they're going to rob me on the subway, they're going to hit me or even kill me in any alley. That's what you can expect. So what you have to do is you have to say, I want to keep a very healthy body. I want to keep a very healthy immune system. Now, if I have cancer, because today I'm talking to you, then I have to say, I have several targets. And if you begin to follow them, you're going to feel benefits. I have to cleanse my colon. I want to rebuild my intestinal flora. I want to reduce my inflammation levels. So I want to be very careful to what I eat, how I eat, keep time. You know, people don't understand how important it is for inflammation control to keep fixed hours for eating. People eat whenever they can. They, and I quote, grab a bite whenever they can. Feeding our body is a very important part of health. So you have to sit down, stress-free, relax. And even if you're going to have a little bite, a sandwich or something, you have to relax, have it, and take your time to eat your sandwich. 10 minutes is enough. But you cannot be biting and on the phone because you're releasing adrenaline. You're damaging your body. So if you have cancer, you have to make sure you begin to separate meal times and relax and eat well. Now, many of the patients that come to the hospital, they have so many problems doing that. But this is the place to handle those cases. When you arrive at BioCare, we place a central catheter. We begin feeding you intravenously. We don't want you to push any food. I don't want you to do any sacrifice, but I'm going to be feeding you because your body needs those resources. Your body needs that energy. Your body needs that protein, but I'm going to put it directly on your vein. So don't worry, you don't have to eat if you don't want to, if you're nauseated. You're going to see that as you recover, your appetite will come back. Your enjoyment of food will come back. But in the meantime, I'm going to be taking care of you, fulfilling every single need of your body. And I'm going to be working on your immune system, because that's the very system that I need to destroy cancer cells from within. We're going to go head on that cancer, but I'm going to use your own cells because you have your own weapons. So, in just few days, in just few weeks, you're going to see how everything starts reversing, because now you have an immune system that works, you have an inflammation level that has come way down, you start feeling different. And then you start feeling like hungrier and eating and functioning better, and everything they can give you, any medication they can give you, is going to be working much more efficient. You're going to need less medication to achieve better results. And all you have to do is relax and say, I'm going to spend 3 weeks at BioCare. That's our cancer program, 3 weeks time. But instead of lying down on a couch or on a recliner at home, you're going to be taken care of. You don't have to do anything. I'm not going to push you to do anything because I know your body is going to bounce back. as I give all these treatments, as I work on the inflammation, as I detoxify you, as I help your body to recover, you're going to see that day by day you feel better, you function better. Nausea is gone, that's the first. Then I feel better, then I feel like eating. Something that makes me very happy is when I making rounds with our patients, when I know that a person that arrived in very bad shape, at the end of the consultation and everything, they tell me, "Doctor, you know what's for lunch today?" That's the clue. They want to eat something. They feel like eating. That means that inflammation has gone down, the intestinal tract functions better, toxic levels have gone down, and your immune system begins to work against that cancer. And we do tests, and you're going to be able to see on the microscope your white blood cells running around, moving around, doing what they should be doing. You're going to see how your red blood cells flow better, how they function better, delivering oxygen, nutrients to the body. So, this is the program for you if you have that. But if you're sitting at home, the first thing you have to do is call me, ask questions, because right now, beginning today, I can help you. Don't stop, don't do anything. Call me, ask questions, tell me what is your problem, because we have to begin today. I'll see you next week.